therapy works with emotions and feelings by processing them rather than cognition. The commonest form of therapy in the Western world is CBT, which works on the premise that thoughts affect emotions. Subjective emotive brief therapy works on the premise that we can alter thoughts when we work with emotions. And not only thoughts, we can change perceptions and behavior too. Subject is the client. So subjective, as psychiatrists, we are trained to be objective. We are trained to take histories. We are trained to make a diagnosis and then provide treatment. Subjective is the client, and whatever the client says matters. Subjective emotions are theirs. I have not been in a trauma. This person has been in a trauma. Collateral history is fine from psychiatric perspective, but subjective history is the most important thing in subjective emotive brief therapy. Permissive and non-directional approach. There is no suggestion that is given. It is totally non-directional. Brief describes the brevity of therapy. According to texts in psychotherapy, psychoanalysis is supposed to be brief when you undergo a weekly session for a year. This is briefer than that. Uses psychiatric history as a source of information for precise surgical approach. In almost all counseling trainings, history taking is frowned upon because what the patient brings or what the client brings is supposed to be what they talk about. In this work, we use psychiatric history to get the precise information as to what exactly we are going to deal with and how to treat them. Brief history of SEBT. Emotional trauma plays a very important role in psychiatric illnesses. We all know that. Unfortunately, emotions are frowned upon in the Western world. That there is a very distinct distinction between Indian psychiatrists and Western psychiatrists. Eastern psychiatrists, Indian psychiatrists give a lot of emphasis and respect to what the patient is feeling and the emotions. A Western psychiatrist is taught not to do that. You will find psychiatrists, but very rarely in Western spheres, who will respect the emotional aspects of illnesses. I worked with Professor Ivor Brown in 1991-92, who is an emeritus professor in UCD in Dublin. He was the first person who put me on this track that I'm on. He taught me the first lesson in hypnosis. And he was at that time doing holotropic breath work, which was a very effective treatment as I saw it. But then it was also not very effective in some cases. So I went over to him and asked him how did it work, and he said he didn't know. And when he said he didn't know, I had nowhere to go to learn. So I took up training in hypnosis from a lay hypnotherapist based in Ireland, and then started my own practice. I did learn EMDR from Professor Brown, and using the techniques of EMDR, I learned that when we conduct this particular form of treatment, there is massive emotional arousal, but it settles down after that. And that raised a lot of questions. Why does it happen? How does it happen? Why does this kind of therapy work in some? And why does it not work in others? Then I realized that the history that we are trained to take as psychiatrists gives us a lot of information to work with a patient without necessarily needing much medication. And the reason was that as many histories as I took, I found that they were dealing with three major traumatic issues: unresolved grief, unresolved trauma, and unresolved anger. There was actually nothing fourth that I could look for. Now, there's a very brief case history. A 30-year-old married father of 2 children came to me who said that he was depressed all his life. 3.5 months before his presentation, he had tried to grasp his wife's neck in a fit of rage. He had had 3 psychiatric admissions. He had had ECT, counseling for 10 years, and he was on antipsychotic medication for 2 years, antidepressant treatment for many years, and he made a very active suicidal attempt to kill himself, trying to drown himself in the river. There was a family history of depression in the father, and mother had anxiety. He was the second of 4 siblings. They had poor relationship with each other. Childhood was unhappy because he was scared of his father. He was fearful in school, very afraid of going to school, but completed school somehow. No third level education. Now, this is a very exceptional case, I would say. It was like I saw magic unfold, which surprised me. We did about 12 sessions. He is now separated from his wife. He is now gainfully employed without medication. And I last saw him about a week before I came in here, and he is medication free for 5 years.